Hi, I'm Tim Schrader. I'm a pediatric orthopedic surgeon at Children's Healthcare of Atlanta, and I've been here for the last 18 years. So I treat all sorts of teens and young adults with various hip conditions. In Mabel's case, I think it was important to first come up with the right diagnosis.
For my symptoms, I had snapping and a popping feeling in actually both of my hips. And when it would snap when I would do certain movements, it would follow with pain when I was walking and doing physical activity.
So Mabel has hip dysplasia. She first presented to me when she was around 11 years of age with pain in her hip and some snapping. At that point, she wasn't fully grown yet. I then saw her back in the office several years later and repeated the x-rays. At that point, she was fully grown, but her hips were still dysplastic. So we talked about a procedure to help reshape her hips and prevent recurrent pain and disability in the future. Mabel underwent a Ganz periacetabular osteotomy. It's named after a surgeon in Switzerland who developed the technique back in 1986. There's few orthopedic surgeons in the Southeast that perform this procedure, and we happen to have several of them here at Children's that do that.
It was surprising and I was scared, but Dr. Schrader really helped us by talking through the process and what it would look like and helped us to understand, and that helped me.
When I called other orthopedic doctors to get a second opinion, they all said, you don't need a second opinion. We would take our kids to Dr. Schrader. He's the best person to do it.
So by coming to a place like Children's where we have experts in hip pathology, imaging, radiology, physical therapy, anesthesia, all those sorts of things, we're able to identify these problems and treat them correctly.